July has been a very, very busy month with the buyout program. We did multiple buyouts, really stretched us all a little thin, but we got through everyone. We took care of everyone. We're going to go through 28 of the buyout horses, 28, 29 on that.
28, I think, yeah.
So to give you a good overview of what we did, is just very, very chaotic doing buyout rescues. And as soon as that trailer pulls in, I know you're right there trying to see, like, almost to prepare ourselves too, like what are we going to be looking at?
Yep, absolutely. And we're going to try to get through this debrief more quickly than we did last time. So I want to say on the front end, I build kind of little walls around my heart, and I can go into like data mode. So I'm going to try not to get emotional about these animals, and it helps that I'm just looking at their sheets. But if you feel like, wow, she said that horse had a broken leg without lots of elaboration, it's because we want you to know the outcome of these animals, but we don't have time to really delve in depth into each case.
And one thing I pointed out, it was in one of the posts, is that these rescue missions are very, very hard for us. And we process a lot off camera at our homes and whatnot. We're not able to go into huge depth due to time restraint. It doesn't mean that we don't care at all. It just means that for our hearts and our mental health, like, we can focus on this a little bit. I think, like, we do these big rescue missions and people are like, well, how many needed euthanasia?
Yeah.
We don't sometimes even know at the end of the day, because there's different euthanasia texts. I mean, sometimes you have to euthanize. Like,
yeah,
we don't know until we get all the paperwork together and everything exactly what happened. And at the end of the day, we don't want to just be answering all the questions and focusing on the negatives. Like, as rescuers, we're trying to hold on to those successes. And so, just so you understand, as a follower and a supporter, like, you want to know, and that's why we're doing the debriefings. And that way we can focus on the positives as much as possible, but still give you the information. But it's we're going to do it, like, emotionally, we're going to go through this, and then we're going to move on, because it's very painful for us. Like, you watch it, and I know, like, people are like, I don't know how you do this. We do it because we have to guard our hearts. We have to be able to do these very challenging things, but we're going to dive into this and just know, like, we care deeply, and that's why we do it. We're not trying to be cold-hearted at all. We have another big rescue mission we have to go on today. So there's just a lot going on, but we want you to know. So
I think it's like asking an emergency room physician, like an ERGP, after like a catastrophic multi-car and bus collision, exactly how many patients did you see? It's not that their patients aren't very meaningful to them. It's that when you're practicing triage medicine, you go from case to case to case, and you don't have time to stop and grieve in the moment. And so that's what you're seeing. Yeah, and not to dwell too much on that.
And some of these rescue missions we do are more horses than one organization could bring in an entire year. And we're doing it in one day. That's so crazy. That is it. It's truly is a triage moment to moment. But we are we're going to dive into this.
Yeah.
So what's
so our first case that we saw, B24-337, was a 12-year-old Belgian gelding. He was the most visibly heartbreaking case that we saw. He had his leg really badly abducted, and we immediately gave him pain medication, and we were able to document that he had fractures of both his elbow and his carpus, and he was given the last act of kindness.
And we are giving numbers, because these are the numbers that are on the sheets. They don't have names. These horses do have names now, but if we were going to go through and put all their names on there, we wouldn't be doing this video today. It would maybe be on Thursday or something, just because the amount of time restraints we have here. So we're not saying numbers because we don't care. It's how we have to keep track of them.
We call them pet names in the moment.
Yes.
Yeah. B24-338 was a 13-year-old gelding draft cross. He was very, very sweet. He had multiple, probably 8 to 10 deep puncture wounds of his left front leg with severe pain and swelling. And what we found on radiographs was that he had evidence of osteomyelitis, which is an infection that has invaded the bone and causes like a moth-eaten appearance. So at that point, we had no treatment options. He was given pain medication immediately, but he was also given the last act of kindness.
And we're just thankful that these horses didn't go to slaughter. Like in this buyout, there was a lot of horses that were really up to weight and whatnot, which was easier for us to see them, but they had a lot of internal issues. But these are horses that would have been shipped. Like these are when we go to auctions, these are what the kill buyers are trying to bid against us because they want these fat horses. So it was a gift that we were able to get these guys.
Yeah. B24339 was a 22-year-old dark bay standardbred mare. She was blind completely in both eyes, and she also immediately received pain medication. She had a fracture of her right pelvis and possibly also her proximal right femur. She also had entropion bilaterally, so her eyelids had folded in and were rubbing on her eyes, and she had very, very painful shrunken eyes, and she was given the last act of kindness.
And when we're saying a broken pelvis or all these things, like a lot of these injuries that we have, we don't see fresh injuries.
Yeah.
And when we do, it's very, very rare. We see injuries where horses have suffered for years in this condition. So it's very rare that we actually see a fresh injury. And like a broken bone.
Exactly. And I am not an equine surgeon. There are cases of successfully fixing equine fractures. Those cases require months and months of hospitalization and a boarded surgeon. And even so, the case outcome is guarded. When you've got something that's been fractured for months, sometimes years, that is a non-union or a malunion, there really are no more treatment options.
The amount of like arthritis getting in those areas, it's terrible,
B24340 was a 20-year-old Belgian mare. She also was very, very sweet. She had bilateral deep suspensory limb desmitis of both of her rear hind legs with severe adhesions associated with the soft tissue structures, and her joints were almost touching the ground, so her legs were very painful. We did diagnose those areas via ultrasound. She also had lameness in her front end, and she was given pain medications and also given the last act of kindness. B24341 is an interesting case. He is a 12-year-old quarter horse gelding with very significant swelling, edema, and fibrosis of his sheath. And don't have any medical history. He also has a sinus arrhythmia versus an AV block. So he has a cardiac anomaly and a very large sheath, but he is able to urinate. We were able to run some blood work on him. We were able to do an ultrasound and determine that his bladder hadn't ruptured. His bladder was functioning normally. So if he had been unable to urinate with that amount of swelling, it would have been an immediate crisis, but thankfully he is able to urinate and his body is systemically okay. So not sure what our treatment options are. He seems to be pretty comfortable. And I have not done a surgical resection of that area, but if it's just cosmetic, then he might make it. If it's some major functional problem that we haven't diagnosed yet, that is just up in the air, but he is in one of our quarantine pastures and he's a very good boy. Am I going too fast? Is this okay? B24342 was a 2-year-old saddlebred stud. Unfortunately, this young boy had an avulsion fracture of the left carpus with a non-functioning carpus associated with deep suspensory limb desmitis. So DSLD is usually a chronic progressive condition we see in older horses. It does cause pain. Initially, you can kind of manage it and mitigate it, but in an animal this young, that has to have been a congenital, very poor conformation. So this poor young horse was painful and he was given the last act of kindness. B24343 was a 2-year-old quarter horse mare. She was bay. She had a very, very swollen right hock, and unfortunately we documented that she had avulsion fractures and also a fractured talus associated with that carpus. The fractures appeared to be weeks out, and the soft tissue damage was also severe, and she was very painful, and she was given the last act of kindness.
And this kind of falls down to where as long as the slaughter pipeline is active and happening, people can be financially rewarded for allowing an animal to continue suffering. Like if you took your horse to the vet and it was like, this horse is all broken up in there.
Yeah.
Euthanasia should happen. And they're like, okay, well, we're going to take it to the slaughter pipeline instead. And legally that's okay in this country.
It's really heartbreaking.
Because like if owners were taking their horses to the vets, like we wouldn't be here making these decisions. We wouldn't be seeing these broken, suffering horses.
What's really hard for me as a veterinarian, knowing what oath vets take, these animals have to have a health certificate signed to travel over state lines. And part of our USDA training that licenses you as a veterinarian, it's an additional licensure, is training for what parameters animals can be transported under. And these types of severe lamenesses should not be passing. So we have veterinarians signing health certificates for animals that are being transported over state lines in really horrific conditions, and it shouldn't be happening. So it's a tough one.
In Tennessee, there's an exemption if an animal, like an equine, is coming into if I'm reading the law right, and it seems to
if you're seeking medical care, right? Like if your horse is...
Well, no, like you can take a horse to auction without a health certificate in Tennessee from another state.
Really?
And without Coggins, without health certificates, and directly so say from like the Indian reservation, they're rounding these horses up, they're taking them straight to slaughter. There's an exemption in a lot of states if the animals are en route to slaughter without Coggins and health certificates. But for us, it's like, okay, we need health certificates, we need Coggins, but the slaughter pipeline's wide open to accept these animals and auctions without proper documentation.
We need to change the laws.
And if we are concerned about disease, like, why would you be congregating a bunch of animals without health certificates, without Coggins, at auctions where the disease is rampant, like the donkey disease? Like,
Horse Plus has been criticized for bringing diseased animals into the state, but those animals are coming into the state anyway to go to slaughter auctions.
9 years ago, I had a Facebook memory, and I was at an auction, and there was 170 horses.
Oh my goodness!
At that auction, and like by the time we were kicked out from that auction, there was like 40 horses. Like there was traders and kill buyers coming to that auction, specifically using it as a hub to ship. And with our presence there for almost a decade, it dropped significantly, and those kill buyers weren't coming there. And now that the auctions kicked us out, I'm not sure exactly what's happening, but the auctions and the slaughter pipeline are a way to reward animal abusers financial gain off of suffering, and laws have got to change. That's why we go to Washington, D.C. Okay.
B24344 was a 34-year-old Belgian mare. These ones are almost the most heartbreaking for me because this mare clearly had been worked right before she came. She had a lot of scarring associated with a harness. She was a very, very low body condition, and she had essentially no teeth. She had no upper incisors and missing multiple teeth, and then her teeth were worn past the level of the gum line. So we talk about the level of the gum line. Her teeth were worn way past that. We estimated her to be 34. We couldn't accurately age her, but she was a very sweet old lady. And even with bran mash and aggressive refeeding, she was at risk for refeeding syndrome and had a very low chance of being comfortable and gaining any weight back. So she was given the last act of kindness.
And this is something obviously she was probably owned by an Amish family. The Amish are not going to be reaching out to a vet and paying hundreds of dollars to euthanize when they can send them to slaughter. And that's what we're seeing so much.
Our next horse, I know his name because I operated on him. His name is Endeavor. B24345 is a 22-year-old, presumptively Morgan. We're guessing on that. Gelding, he was a great body condition score. He had a ruptured left eye. So he had injured his left eye. It was ruptured. And he also was coughing and really pouring mucopurulent nasal discharge. We enucleated his eye the next day, and Dr. Gina did an ultrasound of his thorax. He's been on systemic medications. His cough is improving significantly. His surgery went perfectly, and I just checked in this morning before this meeting. He's doing great. So he's a very good boy, and we're hopeful that he'll make it to adoption.
He seems like a horse that has gotten a lot of attention in his life. We bring horses.
He likes the cookies
into the treatment room, and you can tell it's their first time in a building, and they're like, "Whoa!" he has been someone's pet horse. As like he's way too well ground mounted. Like sometimes we get horses here, well, like Cherokee.
Yeah.
Like we know he came from excellent, loving home, and he has medical issues that they couldn't address, so he's here now. But like some of these horses come in and you can read them like a book, in the fact that
someone cared for them.
Somebody cared for them, and these were well cared for animals. So, he probably got injured. They didn't want to follow the, vet's advice if they took him to a vet. Like, well, he's injured. We're going to find him a good home. And into the slaughter pipeline he went. But thankfully, thanks to your support, we were able to save him. And with his eye being removed, he should be able to make a full recovery.
Yeah.
And go out and be adopted and live a wonderful life.
B24-346 is a 15-year-old presumed Tennessee walking horse mare. She is gaited. She appears to be an older brood mare. We did pregnancy check her. She is not pregnant, and she is down for a sedated dental, but she was turned out into one of our quarantine pastures to depress after.
She's kicked a couple times.
She did not appreciate.
Yes. Efforts.
She also had really low white cell count and was very dehydrated on intake, but she's improved since then.
Given her some time. So how is it having the blood work?
Oh my goodness. Diagnostics are everything. I feel like a broken record when I say this. So we've got in-house blood work capability. We can run CBCs and chemistries and have an answer. The CBC takes 3 minutes. The chemistry takes about 10. So we have systemic answers, and we'll get to him, but we had one older Belgian gelding that we tried to save who went down. He wasn't able to get up, and we were able to run blood work on him and confirm that his liver values were severely elevated. So it helps us feel better that we're making the right call for these animals when we have not just a subjective assessment, but also that objective information. And same thing with all of those horrible fractures. I can't palpate those from the outside. Sometimes we can see them. That first case was very obvious that the carpus was fractured, but soft tissue tears, how severe they are, what their location is. We needed that ultrasound for that, and it's been a tremendous addition. The radiographs are really critical, and then the blood work is really another key triad. And I also don't have to convince the horse's owner to pay for those things. Dr. Gina and I can just go, we need an answer on this horse. We can send somebody to run the blood work, and 10 minutes later we have the answer. So it's tremendous, and I love Horse Plus as an organization, but one of the reasons why I accepted this job is because I love evidence-based care, and it's incredibly unique for them as an equine rescue to have the ability to practice evidence-based care without having to, obviously there's a cost to everything, but I don't get second guessed. Like, well, you already took an x-ray on that horse. You can't also do an ultrasound, and often in private practice, due to financial constraints, you have an owner be like, this is all I can afford, and you kind of have to pick and choose what you can do. I work at a private practice sometimes too, and it's really tough, and no judgment on those owners. All of us have budget constraints, but Horse Plus really is unique in that because we own the equipment, it's not like someone is charging us per x-rays that we take. So we're really, really thankful for our supporters who've helped us get that amazing diagnostic equipment. I'm chatty, and I need to stop being chatty. B24-347 was a 24-year-old quarter horse mare. She had a heart murmur with point of maximum intensity over her aortic valve. We were able to do a cardiac ultrasound on her, and she had evidence of valvular insufficiency. So as we age, sometimes the way our heart valves close crisply stops, and our ultrasound is so amazing. You actually can see blood flowing in real time, and so you can see if there's blood that's not traveling the correct direction, if it's flowing back into the heart, and that can lead to more severe cardiac problems. She also had a very swollen area on her left hind leg, and she had a very painful back on palpation, and she was given the last act of kindness. B24-348 was a 21-year-old quarter horse mare. She was bay with no marks, and she also had a fracture in her right carpus. She was very painful. She was immediately given pain medications, but she had a fractured knee, and she was given the last act of kindness. Can I just stop for a really quick second and say, you guys heard us after this intake say how much better this was than most of our intake days, and these are the cases that we're dealing with. So It is really tough to take all of these horses, and the fractures are easier than a lot of the other ones because it's a black and white answer, but I felt really happy and encouraged at the end of the day because we were able to save so many more, and this is what we're dealing with. So those of you who know me personally in my life know I have to kind of like emotionally prepare and then decompress again after these intake days because they're tough. B24349 was a 24-year-old standardbred gelding. His name was Bono's Dream. He was black, he was very sweet, and we were able to confirm his exact, I'm so sorry, we aged him younger than he actually was. He was 25 based on his brand. He had severe deep suspensory limb desmitis. He had major effusion in his tendon sheaths and a lot of pain on all 4 of his legs. He was covered in lacerations, small wounds covering his body. He also had very bad conjunctivitis, so he had pain in both eyes and he had ear warts, similar to what Glimmer had. And you guys that have seen Glimmer's journey, those are very treatable. But overall, he also had no maxillary, he was missing some teeth. And we took radiographs of his legs and he had some severe bony changes. So he was given the last act of kindness. He just had a lot going on and his body was breaking down.
His personality was so sweet.
He was such a good boy.
And I remember having a conversation with one of the other assistants there, and I was like, we could only do brain transplants. Like he's such an amazing, sweet horse.
I know.
And sometimes we only get to see them at the end, but I'm so thankful that they're standing with us and receiving love, and they know it's going to be okay. Than in a slaughterhouse, like, it can be so devastating.
B24350 is a 1-year-old quarter horse mare. She didn't appear to have any major health concerns, and so she got microchipped and a full intake, and hopefully there's nothing wrong with her and she makes it to a new home. We did run blood work on her, and she had a little bit of neutrophil elevation. I believe we gave her some systemic antibiotics, but overall we're hopeful. B24351 is a 24-year-old standardbred gelding. He's a sorrel, and he also...
No, mare.
I'm sorry.
Yes.
I'm misreading this.
Yes.
This is a mare. Someone wrote M, and my brain read the wrong thing.
We know her registered
This is a mare. Yeah, her registered name is Extraordinary Girl. Would be awkward if it were a gelding. Sorry. She has some major health concerns. She has elevated lung sounds, inspiratory wheezes. She has a cardiac arrhythmia and some back pain, but she was stable on intake, and so she received medical treatment, and we're hopeful that we can pull her through.
And we'll be evaluating these horses, there's ongoing evaluations that happen up in quarantine.
Yeah, we don't just take sick horses and go, have fun in pasture for 30 days.
And we do find things that are like, you know what, this is more serious than we were hoping it would improve or something, and we have to make those decisions at that time, but we can just take to heart that they got to hang out here and be comfortable and happy and under vet watch to ensure that they're doing okay. And
Dr. Jean and I both, we're so grateful for how supportive our staff is. I try to save everything. And this next case, I think, is an example of something that has happened, I think, with almost every intake group. And you've heard me say this before, age is just a number, it's not a disease. So I don't make decisions based on age. I make decisions based on individual health. So B24352 was estimated to be 35-year-old Belgian gelding. He was such a sweet boy. His body condition score was 1 out of 9. So he was the same age as the other Belgian mare that we made a decision on. He also had really severe diarrhea, increased respiratory effort, especially elevated sounds in one of his lungs. But I opened his mouth and he still had some back teeth, but some of his teeth were so severely overgrown that they were pushing through the upper part of his mouth. And I said, He has some teeth in the back. So if you have some functional occlusal surface and you can do the dental work, sometimes those horses do very well. And so we went ahead and we did his dental right there. We reduced those points so he could close his mouth normally. So much more comfortable, right? And so he was fully processed and he was turned out. And the next day he was down and unable to rise and just wasn't interested. And that team ran some blood work, and he's the one that we found had very elevated liver values. So he had systemic disease. And I won't say that I regret that. I don't think he struggled a lot. Our team found him right away, and we were able to give him the last act of kindness. But he's a good example of a lot of the older horses that we see. We don't do every test on every animal because of the sheer volume that we have. We have to make these priorities. And, you know, his blood work was run one day later. I'm glad he had one day of grainies and being turned out. But this happens pretty frequently.
He was able to close his mouth and be comfortable. Yeah. And when we found him down, basically he had laid down and could not get back up. Yeah. He was not like flat out like some of them. You know, like they'll lay down and they'll be paddling, trying to get up. Like he was comfortably just laying there and sitting up. And I had to go up there. You all were very busy with bandage changes. And things. So, but for me to be able to know that he was in organ failure through the blood work made it so much easier for me. And it's in the members video. We recorded everything about that with him. But for me to be able to know that without the blood work, I mean, we probably would have tried to get him up.
Yeah.
And it would have prolonged suffering. And it was just a nice thing to be able to, for me to know and also tell our members and supporters, like, this is what was happening, you know, with him. And I know, like, some of the comments, like, I don't read all the comments, but I read a lot of them, and, you know, the people are like, it was the right thing to do, it was time, but part of them being able to process was knowing, like, he was an organ failure, and we knew that through the blood work. So diagnostics is so important for us, especially, because it makes our job easier. Yeah. We're able to process it better, but also for our followers to know as well.
Yeah. B24 353 was a at least 25-year-old mule. She was a mare, and she had a very low body condition score. We BCS'd her at a 2 out of 9. She had at least 6 masses present, 2 on each side, and then she had several more kind of up underneath her neck. And we ultrasounded those masses. I was able to determine that they were not fluid filled, so they weren't abscesses. They didn't look like lymph nodes, at least not the ones on our sides. But I was able to determine that they were very vascular. So one of the things that we know malignant tumors, most of them have in common, is a very strong vascular supply. So cancer was very high on that list. And then the masses up underneath her neck were also very consistent with additional tumors. Her blood work showed elevated calcium, which is one of the things that's non-specific, but one of the things that often happens when we have more advanced types of cancer is that our calcium starts to creep up. So cancer was very high on our list of differentials for this older mare. And in the moment I said, you know, maybe we can do some punch biopsies and we can get some more answers from those biopsies. But then also, as we moved her, we found that she had really, really severe pelvic lameness and was just very uncomfortable. She was given pain medications. And so overall, we looked at things and we said, this prognosis is not poor. This mare is very, very thin. She's painful, and she probably also has cancer. And she was given the last act of kindness. Oh, this was a tough one. B24 354 was a 27-year-old paint mare. Very, very sweet, beautiful mare. She came in with a very elevated heart rate. Her body condition score wasn't the worst we've seen, but it was 3 out of 9, so she was very thin, and she was very, very painful. She had severe rotation. Dr. Gina's the one who looked at this case and took radiographs, so she was actively foundering. Not to sound like a broken record, founder is laminitis. It's a systemic inflammatory condition. If we catch it early, and we have a great relationship with the farrier team, we can use corrective shoeing, we can use supportive care. And if we can mitigate that inflammation before it causes rotation of the bone, many of those animals survive bouts of laminitis. It's often related to metabolic disease. Almost without exception, the cases that we see already have rotation. And in this mare's case, the rotation was so severe that her coffin bone was almost through the bottom of the foot. She actually was so painful that we didn't pick her feet up to look at the bottom. And to me, based on the x-ray, it's possible that that bone had already created a puncture through to the outside. She also was missing a bunch of teeth and was packing feed in her cheek. And she was given the last act of kindness after having pain medication so we could get the diagnostics done.
I think something that you said is by the time we get some of these horses, they're so far gone. And like sometimes they do come and they have found her and we're able to work with the farrier and get them corrected and get them into homes. But by the time some of these horses get here, like they are so far gone, and I've seen comments of like, you can fix founder, why are they euthanizing this horse? You're not the vet. You're not seeing these x-rays, you're not there with this horse, and in these cases, if a good-hearted person came along and was like, oh, I'll fix it, I'll get a farrier, without consulting a veterinarian and realizing that that coffin bone's only, almost to come through, you're prolonging pain and suffering. And thankfully with founder disease, there is a point where these horses can be fixed, and then there's a point where you're only prolonging suffering. And we have amazing vets that have a lot of experience that are able to look at this. But if you have a horse that has founder, be sure you're getting x-rays, be sure you're following the veterinarian's advice. And, a lot of times veterinarians, when an animal comes in like this and the owner's like, I want to fix this, I want to do this, like the vet will take the journey with you as long as that animal isn't suffering. Like
as long as it's ethical,
meds,
as long as treatment is ethical.
Things.
Yeah.
But even in those cases, it's kind of prolonging the inevitable of what's going to happen. But from a veterinarian perspective, like if the owner's wanting to try, and the animal can be comfortable.
Well, there are some cases, if your horse breaks into the feed room and has a ton of carbohydrates, or, there are cases like grass founder where there's an inciting cause, black walnut toxicity. There are cases where you have something that's not ongoing, or in some cases metabolic disease. If you address the metabolic disease, the risk of founder goes way down. So you're right. But it's like saying, cancer is curable. Well, if you have, stage 1 melanoma that's isolated to a tiny spot on your arm, you might be able to take that off and that's completely curable. But if you have, stage 4 glioblastoma, your prognosis is very different. So some of these disease categories that we talk about are much more complex than just, here's the word for what's happening with this case.
So something to keep in mind as you're on the internet looking around at things, like sometimes, a word can be, the disease can be very advanced or just starting. Okay, I know we have a lot more here.
I'm sorry, I'm being chatty. We're trying to stay focused. B24355 is a 16-year-old dun quarter horse gelding.
Very pretty horse.
He's beautiful. He has a very swollen right hind leg, but his heart rate is within normal limits. He has a very large granulomatous lesion that kind of looks like Cleopatra's on his right hind leg, and he is scheduled for surgery. Another key point to say that not all X is the same. This horse doesn't show any evidence of sepsis or ongoing infection. His wound didn't heal because it's proliferated so much that it can't heal. However, he's stable, and I think somebody asked why we didn't do surgery on Kalahari right away. We are so busy at Horse Plus that we have to make priorities on who gets what, and that horse has probably had that granuloma on his leg for 5 months. So we want the best case outcome that we can, but we have to make sure that we have the hospital space and the staff for best case outcome. And the risk that we have with that surgery is I'm removing tissue right next to a synovial structure, so it has to be done fully sterilely, and then our post-surgical bandages have to be sterile. And so we can't just kind of go, oh, let's just do the surgery out in the field and turn it back out afterwards. We have to make sure that we have the appropriate staff for the aftercare. So hopefully he does well. We haven't operated on him yet, and we plan to as soon as we can. This one made me really happy. B24-356 is a 5-year-old quarter horse mare. She's small for a quarter horse.
Yeah,
quarter pony. She didn't have any obvious health concerns, but she had some mammary development, and we did a pregnancy check, and she is pregnant. She's very early pregnant. We had a fun day with our new ultrasound, and she is doing very well, and she has turned out with some other mares. So we'll keep monitoring that. We'll probably ultrasound that pregnancy again and try to make sure that we can get a better idea of her parturition date. B24-357 was a 21-year-old quarter horse mare. She was on the thin side. She was a 4 out of 9, so not a terrible body condition score, but she was blind in, I can't read my own handwriting, both eyes, with shrunken, painful eyes, and then she had severe deep suspensory limb desmitis of both of her hind limbs, and she was very, very painful. So she was given pain medications so that we could do her exam, and then she was given the last act of kindness. This mare would have needed both eyes removed surgically, which is a big deal, but then she also had very swollen, very painful hind legs. So sometimes one problem might be fixable, but another problem might not be. And sometimes maybe you have fixable problems, but if you have 11 of them, what helps one problem hurts another problem. And we have to kind of keep all of that in mind as we assess these cases.
Pass them down for you.
Okay. B24-358 was a 25-year-old quarter horse mare. She had a grade 4 out of 6 heart murmur. She had severe conjunctivitis in both eyes that were painful. She had very large scars with evidence of bony remodeling in her right front and left hind legs. And she had elevated lung sounds in both lungs. And this poor mare, she was one of the worst trauma responses in this whole group. She was absolutely terrified of humans. She had 3 different auction tags on. She was 25 years old. She was at an elevated concern of having a cardiac event, and she was painful, and she was given the last act of kindness.
It's really, really sad. Like,
I know.
She's just been an older horse thrown from one auction to the next to the next.
Yeah.
She wasn't in like a really fat, shippable condition.
Yeah.
And so these horses just bounce around. It's so sad.
B24-359 is a 20-year-old quarter horse mare. She's sorrel, and she also was very agitated and concerned, but we were able to work with her. She had a little bit of mammary development, so we did a pregnancy check, and there were no signs of pregnancy. And other than her trauma response, she appeared to have no major medical concerns, and so she was turned out to decompress. B24-360 is this guy. He is, I just wrote old, you guys. He is an older miniature gelding. I put 23 down because we had to have an age for his coggins, but his incisors are so worn down that it's really hard to tell with angles, and a lot of mini horses have congenital abnormalities of their head. So to be honest, I don't really know how old this guy is.
He could be 60 years old.
He's old. His body condition score was a 2 out of 9, so he's also quite thin, and he was missing a lot of patchy things of hair. He's also blind in both eyes, completely blind. However, he does seem like he's very well adjusted to being blind, and he was very sweet and kind of listens and moves towards you. And because he's a miniature horse, we know that sometimes those guys, if we can fix their teeth, can gain weight pretty quickly. So I have him down for a sedated dental. He's doing well. We have him in a stall that he's done really well in. We have him in a big stall because he's blind and teeny tiny and very old. We didn't want to turn him out. He has a buddy next to him in a different stall. B24-361 is an 8-year-old paint mare. She is gaited, so we put her down as a Tennessee walking horse. And she had a pretty superficial wound that didn't look to be too bad. She's a biter, apparently. Dr. Gina initialed that one. She tried to bite Dr. Gina, but she had no major medical concerns, and so she received intake and was turned out to decompress.
Was she the one that was like kind of PTSD acting?
We had a couple mares, that were just, and so behaviorally, we don't want to adopt out dangerous animals, but so many of these animals, we don't know what they've been through, and we don't want to make decisions on an animal that's just been through a lot of trauma. We want to give them time to decompress, and then Corey and our other trainers do a great job of working through really specific ways to determine whether or not an animal needs specific training to be safe to work on.
I think she was when we had to load up in the trailer and
to move. Yeah, we couldn't even get her, even though she was halter broken, we couldn't get her safely turned out into the field. We had to load her in a trailer and take her to the field.
Very traumatized horse.
Yeah. B24-362 is a 13-year-old appendix mare. She looks like a thoroughbred, but she's on the smaller side. She is bay. She had a pretty deep laceration over her eye that I sutured up, and she is down for a sedated dental and a pregnancy check. B24-363 is a yearling quarter horse colt, and he is down to be castrated. B24-346 is a, this guy, Dr. Gina did this one. If you see me like staring at the sheet and reading stuff, Dr. Gina and I divide and conquer. So some of these horses that I looked at, I remember, and some I don't. So Dr. Gina looked at this one. We think that this guy might have been a former rodeo bucking horse. He's very handsome and
gorgeous
and a bit wild.
Yeah.
We aged him at 6 years old, and we have him down as a draft cross. He is a bay with a bunch of marking, and
he's a couple brands.
Yeah,
like,
he
looks like bucking stock. Yeah.
Dr. Gina has tried to cow kick while a sculpting heart, so we're not not sure exactly physical exam wise. Sometimes it's difficult to do a really thorough physical exam, and it says that he was afraid, but his GI sounds were normal. And eyes, ears, lymph nodes, everything else appeared to be normal. So again, we don't want to make behavioral decisions unless an animal truly is a danger to themselves or others. And so this guy was fully processed and has been turned out to decompress.
And he is a really pretty horse. And sometimes bucking horses just don't buck good enough.
Which is a great problem to have if you want to be adopted.
Yeah, good training and everything. Like, they can adjust to be really amazing horses for saddle horses and stuff. But he is going to be a very interesting journey, I think, with us. Like, he's if he can be trained and adjust well, like he's built like a tank.
Mm-hmm. And we had another horse that came through, an 11-year-old gelding, who our trainer actually adopted. So we have some horses that physically don't have a problem, but have some major issues. And so it's always exciting when somebody with professional capabilities can take some of those more difficult animals behaviorally. If you see our staff adopt animals, it's usually the ones that we're like, well, nobody else is going to appropriately care for this animal, so maybe we'll take him home. The last one in this group, B24-365, is a little yearling filly. She is chestnut. We have her down as grade, and she had no major health concerns. So she got full intake and is turned out.
Yeah, so
and that's it.
Hope you've enjoyed this. I know at the beginning there's a lot of horses that need euthanasia or were euthanized like right at the beginning, but that is how our process is when they come off the trailer. We're focused on the most critical, and then by the end we're going through the less critical ones. So please let us know if you like the debriefing of the buyouts. Please in the comments, like, they do take time. But if you want to see more of them, like, let us know so we can continue doing them. Because if we're not getting feedback of like you all are interested in this, we will find lots of other things to keep ourselves entertained and busy here.
For sure. I have one really quick comment, and that is, I don't know if you noticed, but there was fracture, and then a couple normal horses that we were able to save, and then another fracture. Sometimes animals are mask pain, or sometimes we aren't safely able to catch them. And so our staff is actively trying to visually assess animals and get the most critical ones first. But we have so many critical ones that sometimes we can't safely access animals first. So if you're like, I can't believe they looked at, a yearling before they looked at this horse that had a fractured carpus, usually that just means we're doing the best we can in the moment and we're safely not able to access those animals. The sweet older ones, usually we can go in and get a halter on, but sometimes we just can't. And we only have one squeeze chute, so we have to use our judgment, but we can't put two animals in there at the same time.
And then when the vets see an animal that is obviously suffering, they give it pain meds right away. So I know
Right away.
I have seen times
Yeah.
where a horse gets pain meds and is set aside,
Mm-hmm.
and then when we get to look at it, if it's not as critical as others, but pain is a very painful, horrible thing.
And
so we try to
Yeah.
stop that as
And we
quickly as
use
possible.
heart rate to gauge response to pain medications. And there are cases where we give pain meds and we're like, I really want foot radiographs on this horse. And we check a heart rate 10 minutes later and it's still through the roof. And we're like, we can't get those diagnostics done. This animal is so painful that it's not fair to them for us to get those answers. And in those cases, sometimes we make last act of kindness calls, just with a visual exam. Usually we try to get the diagnostics, but there are times where we have to use our heart and those subjective information to not prolong suffering. So we do that whenever possible.
Well, thank you, Dr. Lydia. I know you got a
Thank
very
you,
busy
Tawnee.
day.
You do too.
I know we're going to go rescue a bunch of donkeys apparently here shortly. So, again, just thank you so much. We couldn't do this without you, and this is very important. Even though it's incredibly hard, it's very important. So, thank you.